Hey there, John Farahmand here from Balanced Physical Therapy to talk to you today about the posterior rotator cuff. Now, what in the world does that mean? First of all, when somebody talks about their shoulder and they talk about their rotator cuff, I wanted to say that one, this is not a cup. It's a cuff, like the cuff on your shirt or the cuff on your pants. And the reason it's called a cuff is that the muscles of the rotator cuff in the shoulder surround the head of the upper arm in a circular conjoined tendon, and their job is to keep the proximal humerus, the top of the bone in your upper arm, centered in its socket, which is really shallow, the glenoid. Today specifically, what I want to talk about is the posterior rotator cuff, or the two muscles in the back of our shoulder blade and the back of our shoulder that are largely responsible to help people with what's called impingement syndrome, or that pain that you get when you reach really far overhead with one arm sometimes. What you'll notice is there's a little space here. It's called the subacromial space, and sometimes when we reach overhead, if our posterior rotator cuff, infraspinatus and teres minor by name, if they're not doing their job, which is to externally rotate the upper arm and to pull it down away from the acromion, then sometimes that allows the humeral head, the bone in the upper arm, to ride up and get pressed right up underneath that acromion. So why this talk today? Well, back when I was able to go to the gym that I enjoy working out in, I saw a gentleman in front of the mirror with a dumbbell, and he was going like this. He was actually holding the dumbbell, and it was heavy. This is only 10 pounds. It was a heavy one, and he was rotating it like this. And just out of curiosity, I asked him, I said, "Hey, what are you training with that exercise?" And he said, "My rotator cuff." And I thought, oh boy, no, you're probably just, really ruining your proximal biceps tendon, but that's another talk. Anyhow, what I want to talk to everybody about today is the idea that the posterior rotator cuff is at an attachment that's behind and under the bone in our upper arm. So when we take a cable attachment and we drop it down, for example, like this, and we take a pulley or a cable and we pull in this direction, we want this resistance to be parallel with the muscle fibers. Why? So that we can shorten them across their distance as much as possible. That's number one. Number two, remember, the posterior rotator cuff has two functions predominantly. One, spinning the bone in the upper arm to the outside, and two, pulling it downward away from the acromion up above. So if you have any questions about how to train your posterior rotator cuff, just remember what it's there for. It's designed to externally rotate and to depress or pull your humerus downward. Thanks so much for listening.